Hey y'all, it's Eric from SecondSkin, and today I'm here with Dr. James Kerner, a practicing dermatologist out of Las Cruces, New Mexico, and he may be perhaps the most tattooed dermatologist in the world. Is that fair to say?
I think so. If not, I'm getting pretty close.
All right, all right. Well, we'll cover that too, but tell me a little bit about your background. How did you become interested in dermatology? What school did you go to? What's your practice look like currently?
Okay. I've always liked science. When I was a kid, I thought I would become a scientist. I worked in immunology labs in high school and in college. After college, I wasn't sure whether I was going to go to medical school or graduate school or combine them and try and do like a crossover between, research and practicing medicine. So I ended up doing a combined MD PhD program, University of Washington, with a PhD in immunology. I didn't know yet that I was going to be a dermatologist. There's a fair amount of overlap between derm and immunology. A lot of what goes wrong in the skin or how you treat it relates to either too much or too little immunity. But when I did a derm rotation in medical school, I noticed a couple things. One, it was really visual, and I'm a photographer, and I liked that you could make diagnoses yourself without having to order a blood test or a CAT scan. To be able to look at something and have a good sense pretty much right away what it is was appealing, kind of like old school medicine. And I like that. I also noticed all the dermatologists were really happy. They weren't, grumbling and morose like a lot of the other specialties are. They have fairly regular hours, that you can treat patients from babies on up. There's a mix of medicine, surgery, pathology, aesthetics. So there's a lot of different stuff going on in it. And it's a lot of fun. And it combined well with the immunology background too. After medical school, I did a derm residency in the Harvard system in Boston and a
Nice.
fellowship there in clinical trials, testing different drugs on a variety of skin conditions. I like research. I didn't really like academia that much, a lot of
Mhm.
politics. So after I was done there, I went to New York and I practiced for a few years there, and then moved out to southern New Mexico, where there's a big shortage of dermatologists.
Okay.
Almost all the state is high desert. The UV is off the charts. You get more UV here on a cloudy day than you do on a sunny day on the beach in LA or Miami. And I like treating skin cancers, and I've used some of the immunology background to work on ways to treat skin cancers cheaply and effectively. And it's been a lot of fun. For the last 7 years, I've been part of a private equity-backed dermatology company that acquired my office, and I have an administrative role with them too as the medical director for the state. And that's fun because it allows us to come together and try and make the company better all the time. Myself and the other medical directors meet every couple of weeks, and all we talk about is how to make it better for patients and for the providers, the doctors, and the mid levels, and that's been a lot of fun. And it also gives me an audience to talk to about inking too. Doctors remain sort of knee jerk, hostile towards inking, indifferent at best, hostile fairly commonly. And my company now has about 1,000 employees, and when we have an annual meeting, it gives me an opportunity to have a captive audience for a lecture, reminding them about how popular inking has become and how we really owe it to our patients to know more about it
Yeah.
beyond just, hey, let me laser that off for you.
Yeah, it's interesting speaking about that. But the last time that I did go to a dermatologist, I felt pretty dismissed because of the amount of my tattoos. So it's interesting that you're saying that a lot of them do feel hostile towards that, because that has been my previous experience, at least. So
Yeah, and it's an issue because it affects access to care. There aren't enough dermatologists to begin with, so people who have skin issues, especially in an aging population, have a hard time getting in. And if you're somebody who has either the potential for an ink problem because you've got some comorbid condition, or you've developed one, or you just have questions about how to do it as safely as possible, as effectively as possible, you're going to be reluctant to go see this doctor who is either going to not know anything to help you anyway, or kind of be finger wagging at you about being so reckless with your skin,
right,
supposedly.
right. Now you started collecting tattoos older in life. What got you interested in that? And maybe you can talk about who you've been tattooed by. I know you've done a lot of traveling for tattoos, and you have over 300 hours worth of work on you. Is that right?
Yeah, I'm over 300 hours now. I've always been interested in my job. I see people's skin all day long. Doing exams for skin cancer, you got to go head to toe. So I've seen lots of good and bad inking over the years, and I've always thought it might be something fun to do, but I'm often slow to the party, and it took me a while to get around to doing it. One of my photo projects from an animal rights project that I did about 20 years ago involved a bunch of animal skulls. And I've always liked skulls and bones and how they divide the gap between animate and inanimate. I had a friend of one of my sons who's an artist draw a kudu skull that I thought would really go nice on my back. That was about 5 or 6 years ago. And it just took me a while to get around to doing it. I like to travel a lot. And then I thought, why not combine the two? Be interesting to find good tattoo artists around the world and see how much ink I could get. Although in the beginning, I didn't know that I was going to go for a bodysuit. I had thought maybe I would stop after one. My artist in England, Adem Semturk, who's in Northampton, did the kudu skull over 3 really long days 3 years ago. I told him, yeah, this is probably going to be my only one. And he just sort of laughed because that's probably almost never the case. In preparing for that, I learned a couple things. First, that the derm community had nothing to offer, even though they should. Second, that I could use my training to come up with protocols for preparation, ink selection, and wound care. And over the course of those 3 long days, I learned some more about how to take care of the wounds, how to do pain control. And I thought, if I keep going, I'm just going to learn more and more, and that could be useful. So after that, I started a website called the Ink Doc, which has protocols and summaries on how to do all these things. It has podcast interviews, a Tat of the Week, a Tat of the Week archive, the latest news, product selections. And I should mention, although I endorse products, I don't take any compensation for doing so to keep it, objective. And so then I thought, well, I should probably just keep going because I'll learn a lot more and it'll be fun and I can do some more traveling. The next one was a front piece that I did collaborating between Yomiko Moreno in New York and Sandra Riffard in southern France. I couldn't decide which guy to use because I really love both of their work. So I asked them, hey, why not a collaboration? And it was not the typical collaboration where you're in the same room together.
Right.
They've never been in the same room together. They knew who each other was. They'd seen each other's work. So they were excited to do it, to my surprise. I didn't think they'd go for it, but they did. And I made 7 trips back and forth, and
Wow.
it worked out really well. It was a really fun experience. And so then I was hooked. I knew then I was definitely going to go for the full bodysuit. Then I did my legs, 2 leg sleeves with Machida Horiken in Tokyo, traditional Japanese art. That was an amazing experience, painful, but totally worth it. And around the same time, I also worked on my buttocks with Steve Butcher in LA on one cheek, and Vero Imbo in Montreal doing the other. And that just leaves arm sleeves, which are coming up, and then I'll be close to being done.
And you've kind of come together. You talked a lot about your blog, your regiment. You have made it a bit of your mission to bring this education to collectors, tattooers, and the medical community. Why is that important to you?
They're all pieces of the same puzzle. Obviously, the collector is the one with the real skin in the game. They're the ones who want to get the kind of work that they want. They want what they envision to end up being at least as good, if not, better when it's actually done. They don't want to have any problems. Nobody wants to get scarring or infection or pigment dropout, given the investment of time and money and a limited surface area. There are only so many you can get before you run out of space. So you want them all to be what you want. So certainly the collector is invested in knowing what they should do in order to avoid complications. The burden is not exclusively on the artist to avoid them, right? Of course, you want an artist who is clean and uses good sterile technique and autoclavable or disposable tools and good commercially available pigments. Some of the burden is on them, but when you walk out of the studio and you go home, if you get an infection at that point, it's probably your own fault, for not taking good care of it or being colonized with some bacteria and not doing ahead of time to prevent it. So the burden is shared between the artist and the collector in ensuring a good outcome. We're all part of this. So both of those components need to do what's best, and certainly the doctors and other providers need to be on board ahead of time, especially for patients who may have something unusual that makes a potential for increased risk for complications like eczema or psoriasis or lupus or immunosuppression in, say, a liver transplant patient. So there, you definitely want to have a medical professional know something about this beyond just how to laser them off. And if there are complications, the artist is going to say, I can't prescribe you an antibiotic. I wouldn't. That's not my territory. You got to go see a doctor. So clinicians need, I think, to be ready, be prepared to be involved at all stages. If a patient comes to me and asks, what inks should I use? I'm getting a tat next week. Do you have any recommendations? A dermatologist should be prepared to give a rational answer, especially since upwards of half of our patients now have ink. That's a huge chunk of the country, and so we're obligated as clinicians to be useful in that setting, especially dermatologists, because this is a skin issue. So I would like to be a resource for everybody in the whole picture, from the providers to the artists to the collectors. Everybody has a role in ensuring good outcomes.
You have a very extensive, most extensive I've heard, pre-tattoo regimen, and it's also on your blog, your website, so we'll have a link there as well. So if you're watching this, don't worry about writing everything down. But can you talk to us about that, what the different steps are for, how they help, that sort of thing?
Sure. If you look at the protocol, I've got a 10-page tome that goes over the whole thing, and then a bullet checklist that's more concise. I do almost everything on the list because I'll recommend at least some of it for some people, and I want to be sure that they're safe and effective, that they don't interfere with the outcome. So for the average collector, you don't need to do even half of what I do, but I try everything because I want to know what it likes, what it feels like. Does it work? Is it bad? Is it good? So before I recommend anything, I try it myself. So the list is long because it includes recommendations for all comers, including people who might have a greater risk for infection, like those who are on immunosuppressive drugs or who have autoimmune conditions that predispose to scarring or something like that. So I do everything. The list shouldn't be daunting to the average collector because it can be pared down to something very simple, cheap, and not time consuming. But it boils down to a couple different categories: infection prevention, which you can do before, during, and after the inking; pain control, trying to limit the inflammation, trying to get as good and as quick wound healing as possible. Those general categories apply to everybody. And then there's some special circumstances where you want to go the extra mile, for example, with a cortisone injection in the leg or topical anti-inflammatories, to prevent the development of, say, psoriasis in a patient getting inked, because if you scratch your skin and you have psoriasis, you may get a straight line of psoriasis in a couple of weeks. And that could definitely have an impact in the final image in a tattoo. So anti-inflammatories are really useful for patients who are prone to overdoing it with their immune system. For people who are immunosuppressed, they have to go the extra mile with infection prevention, and that's where I'll recommend oral antibiotics beyond just good antimicrobial washes.
I mean, you talk about how a lot of doctors, a lot of dermatologists aren't necessarily on board with this. How would they do that? How would they approach their doctor or their dermatologist and say, like, hey, I really want to get a tattoo. How about antibiotics to help? Do you think a lot of doctors are receptive to that?
Probably not very. I mean, they might pick an antibiotic that would be rational. I mean, that's what I did when I started doing this. They do know what common pathogens are in the skin, like staph, strep, E. coli, Pseudomonas, fungus. I mean, they do know what to expect, but I think they just really don't want to get involved. They just think this is sort of not their thing.
Okay. Do you have any advice for someone getting their first tattoo, for example?
But you do want to develop good habits, preparing your skin. Everybody's skin harbors a lot of bacteria. Some of it is good, some of it is pathogenic. There are a lot of common infections like methicillin-resistant staph, MRSA, which you used to only see in locker rooms and gyms, but now, about a third of people are colonized with it. And so you have to keep in mind that you can be the source of your own bad outcome when getting a tattoo. So developing good habits of cleaning your skin in advance in a way that is safe and non-irritating. If you break your skin out in a rash or you dry it out and it gets all cracked, because you're overzealous with the wrong anti-infection protocol in advance, your artist is going to take one look at your skin and say, we're not going to be able to do it today. So developing good habits from day one is a really good idea.
One of the things you brought up briefly a couple of times was ink fallout. What causes that?
Tattooing involves injecting of the ink into the dermis, roughly 2 to 3 millimeters down, depending on the location, but not all of it stays there. In fact, most of the needle administration is not an actual injection the way you would do it with a hypodermic, because the needle tips are solid. They're barbs. They're not hollow bored needles. And apparently what happens when you break the skin with these is they go in, some of the ink is sort of wiped off by the surface of the skin, and you create a little chamber, and when you pull out, a little bit of a vacuum is created, and the ink gets sort of sucked in from the surface. So there'll be a continuous column of ink from the epidermis down into the dermis. That's why ink looks so good day one, because it's all the way to the top. It's not, partially covered by an epidermis that no longer has any ink. The ink is full thickness. And so some of that is going to get lost. Your epidermis turns over. The epidermis you have today is not the same epidermis you had a month ago. So during that turnover period, you're going to lose the ink that was deposited superficially. However, I think the skin is also good at trying to push out foreign material. Like you get a thorn in you, your skin can react to it and it can extrude it. And this can happen with ink as well. So not only does the ink on the surface get sloughed off, but some of the ink that's in the dermis gets actively pushed out. And occlusive dressings, which I'm happy to talk about at length, I think contribute to a decrease in that ink dropout. Judicious use of topical anti-inflammatories, such as topical steroids and a topical vitamin D analog that I also use post-inking, I think do this as well by cutting some of the inflammation that you get post-inking from the trauma and from the foreign material. Both, everybody's going to get some inflammation. I think that inflammation contributes to extrusion of some of the ink as well, and cutting down on that post-inking inflammation can lessen it too and give you a very, very vibrant tattoo. A huge amount of ink is deposited in the skin. If you look at some clinical studies that have been done in humans and other animals with tattooing, if you look a year after a tattoo, something like 90% of the ink that was initially deposited is gone. It's been either extruded or broken down, transmitted to the lymph nodes. We don't know fully where it goes. It's just not there anymore. But it's so heavily saturated on day one that even if only 10% is there a year later, it looks great to our eyes. If you can maximize how much ink remains in the skin, I think not only is that healthy for you, but it ought to preserve some of the durability of the tattoo as well, so that you don't dip far below that 10% over the subsequent years and get more fading. So anything that you can do to protect the tattoo from extrusion or degradation, which we can talk about, whether it's from sun or lasers, is going to help keep the ink safe for you and also looking vibrant.
Awesome. You mentioned occlusive dressings can help prevent fallout. An occlusive dressing is a medical grade bandage similar to SecondSkin or some of the other ones that are on the market. Can you talk about exactly how those work?
Sure. So these are breathable plastic bandages that have a sticky side. And so they're applied to the skin immediately after a tattoo session, and they can be left on for varying amounts of time. For the first day after an ink session, there's a good bit of inflammation. There's accumulation of serum, a little bit of blood that will leak out. And so you typically change these bandages at 24 hours. Subsequent to that, they stay fairly dry, so you can leave a second piece on for 5 to 7 days even to get good healing. The advantages of dressing like these are several-fold. First, they keep the bad stuff out. You don't have to worry about having a Vaseline-laden leg attracting dirt and dust in your clothes, or you're messing up your sheets. These dressings are very clean. They keep bacteria, dirt, anything that you don't want onto your skin whose barrier has been somewhat broken to be exposed to. So they keep the bad stuff out, and then they help to keep the good stuff in. The good stuff being moisture. Your freshly inked skin is not going to dry out with an occlusive bandage that helps retain moisture. It also helps keep the temperature nice, keep the body temperature up in the skin. which tends to be a little bit cooler than more internal parts of your body. And it also keeps moisture in that, that would otherwise be lost into your clothing or sheets and take some of the ink. You don't have to worry about that when you're back home and you've got something like SecondSkin on, because it keeps everything in that you want. And I think keeping the ink concentration higher by virtue of the dressing helps to keep less of the ink from being extruded. It's harder to push it out when there's something on the surface that's keeping it in. So these are very useful for avoiding infections that could be acquired post-inking, when it's solely the collector's burden to avoid a problem at that point, when you're all done with the artist. I think it speeds healing too. When I use occlusive dressings that are off at about the 6th day post-inking, they're almost fully healed. There may be slight areas that are a little bit crusty still, especially in reds, which seem to take longer to heal. But by and large, the ink is almost fully healed when these dressings are done. So it really speeds up the process. So if you're looking to go back to your artist fairly quickly, you can do it a good bit faster if you have a good occlusive dressing on. So keeping the bad guys out, keeping the good guys in, taking a lot of the time off of this, because if you have a big piece to put on balm 3 or 4 times a day, it takes a lot of time, aside from the mess. And if you have an occlusive dressing that's been on for several days, it's zero maintenance. There's nothing you have to do for it. So it does save a lot of time. You can go in the shower, you don't have to change it. They're waterproof. I don't recommend swimming in the lake with one of these because your skin is not fully healed, and there have been cases of bad infections that way. But it makes it simpler and a whole lot easier, a lot less time consuming. So there's zero downside. But the products all come in a neat packaging system, unlike a roll of saran wrap where you take a sheet off and it immediately folds onto itself and crinkles up and you have to throw it away and take a new one. The occlusive dressings come in a sandwich, which makes it very easy to use. There's a rigid backing that you take off, exposing the adhesive side. And you put that down. There's another backing that keeps it intact so it doesn't do the saran wrap game. So they're very easy to use. You can cut them to size. You can overlap. But there's a little bit of a learning curve, and in taking them off, you want to be careful because your skin's fragile. You don't want to rip your skin. You don't want to suffer any more than you have to. So there's a bit of a learning curve to the application and to the removal, but it's very easy, and you'll get it fully the first time you do it.
There are a couple of different ways to remove it, actually, and I don't necessarily find one easier than the other. Some people have a preference. Is there a way that you recommend taking them off?
I like the hot shower approach.
Okay.
Because you can really soften the glue from the adhesive, and you immediately start washing the area as well. So if you're doing it in the shower, you're not going to forget to do a nice cleaning when you're removing or changing your occlusive dressing. So the shower is a really good place to do it. You want the water pretty hot. You want to let it run on there for a minute to really soften up the glue. And you want to peel from a corner if you can, and do it close to and parallel to the skin, not to pull away from the skin so that you're pulling your skin up. You want to minimize trauma by pulling flush to the skin, minimizing traction and friction on it. And it's not bad. If you can have done some type of hair removal before, that's good too. Otherwise, you get this sort of slow Brazilian with these 1/4-inch length hairs, and that's no fun. But so yeah, if you don't have much hair there, and you heat up the glue and you're ginger about how you remove it, it's not a bad experience. So I like taking it off in the shower. There are other things you can do. You can apply vegetable oil or mineral oil to the leading edge and kind of massage it around. That helps to break up the adhesive too. There's more than one good way to do it, but yeah, those are, in my opinion, the two best.
Yeah. What I found though is using a hot shower and breaking that adhesive down, sometimes it leaves an adhesive residue behind on the skin. What's the best way to remove that?
I think there you're back to an oil. You
Yeah.
just sort of swirl the vegetable oil on the area. I've actually not noticed residue much with the products that I've used, with SecondSkin or others. But anytime there's glue on the skin, that's a possibility. And yeah, so using a vegetable oil afterwards and kind of swirling it, you tend to ball up that adhesive and it'll wash right off.
Yeah, that's what we typically recommend, is like a coconut oil. Our tattoo cream works really well because it's coconut oil and shea butter based. And yeah, just gently massaging that in, and that'll help remove it. Besides people who obviously have a medical adhesive allergy, who else shouldn't use this product, or when should this product not be used?
There are no contraindications besides adhesive allergy, really at all. If you think you're going to be getting, immersed in water on the job, you probably should get inked when you're on a holiday. It would be a mistake to assume that an occlusive dressing would, prevent any complications, and you can go, jump into the Rio Grande, or, go scuba diving somewhere. So you don't want a false sense of security from a device that's designed to offer protection under most circumstances. You don't want to exceed those, by saying, okay, now I can go in the hot tub because I've got this occlusive bandage on. It doesn't matter. No device like that is foolproof. So, if you're planning on going into a fresh body of water or the ocean, you should probably be delaying your tattooing. So yeah, aside from ink allergy, there really is no contraindication at all, in my opinion, to using occlusive dressings. They're largely for everyone. You can try different dressings. I like the balance in SecondSkin. It has the right amount of adhesive. Some of the other products seem to have too much or too little, and that can make for greater risk for allergy or irritation. I've used half a dozen, but I do like the balance in SecondSkin, so that it stays on nicely. It's not a bitch to remove, and I have not seen as much irritation or allergy among collectors that I know from it. But yeah, to circle back to your original question, aside from adhesive allergy, there's zero contraindication in my book.
What do you think are the most important steps for a client who has just been tattooed in order for them to take care of that, help it heal?
So they've already done the good stuff. They've done their due diligence ahead of time. They've used antimicrobial washes. Of the ones on the market, I recommend the colloidal silver soaps that are available from your company and a variety of others. I like dilute chlorhexidine, as long as you don't get it in your eyes because it's an irritant. As a dermatologist, I recommend benzoyl peroxide all the time. It's okay to use in an area that has no ink in advance, but I wouldn't get in the habit of using it too much in this setting, because you really don't want to use it once you've been inked. So you've done your due diligence, you've cleaned your skin. If you're at extra risk for infection, you've taken some oral antibiotics that get into the skin nicely. You've identified a good artist who does great work and is very clean about it and uses good inks. And you've been there, you've gotten your ink done. They've done your session for the month. In a multi-day session, you're just tasked to clean it and keep it from being too much of a mess. But once the final day is done on a multi-day session, or if you're only doing one day, now all the onus is on you as the collector to do what's necessary. Ball is totally in your court. So you should bring an occlusive dressing with you to the studio, unless the artist has them and is going to provide you with one. And that should be on, as soon as the inking is done and the area has been cleaned and dried. That should stay on for 24 hours. If you're at heightened risk for infection, I would continue oral antibiotics all the way up until the final dressing is removed. But that early in the game, because these dressings are so user-friendly, there's nothing else you really have to do other than stay out of the sun, which degrades tattoo pigment. But once you take the bandage off that first time, after 24 hours, you need to do a really, really good cleaning. Make sure all of the residue of the soap is gone, so that the next piece will stick on well, and that you won't have potentially irritating particles stuck under the bandage for the next 5 or 6 days. So you want to clean it really well, let it air dry, and be really dry before you put on the next dressing, because that's the one that's going to stay on for, in my case, I usually do another 5 full days. Once you've had that on, you're back to not having a whole lot to do. You can continue the oral antibiotics if necessary, stay out of the sun, avoid going into bodies of water that you shouldn't be going into at this stage. And then after that second stage, when the 5 or 6 additional days are up, and you carefully remove the dressing in the shower, things will be largely healed, but depending on the colors, there'll be areas that may have a little bit of, sort of pseudo scabbing. They're just a little dry, a little bit elevated.
Any lesser known aftercare tips that you might have for people?
I like at least a little bit of use of a topical cortisone, even if you don't have a risk for, say, psoriasis or lupus developing within a tattooed area. In those cases, you want to hit the areas pretty hard and even do systemic steroids beforehand, like intramuscular Kenalog. But for the average collector who doesn't have risk factors like that, A couple applications of a strong topical cortisone are very nice. They really cut the itch. They cut the other elements of inflammation like the redness, the elevation. I think they really speed healing, and in my experience, have zero impact on negative ink retention, on ink loss, and they may actually help keep even more ink in the skin by cutting that inflammation that's designed to get stuff out of the skin that your body thinks shouldn't be there. So a couple applications, but not too many, of a strong topical cortisone, which you can get by prescription from a doctor. Ones like clobetasol, halobetasol, fluocinolone. They're a whole bunch. They're rated by numbers from 1 to 6. 6 is like what you get over the counter hydrocortisone in Walmart. But the strong ones are several orders of magnitude stronger. And just a couple applications of those the first day post dressing removal, I think really helps take that little last edge off of the inflammation that's a necessary part of the healing process, but not more than that. These medications, if they're overused, can cause thinning of the skin, atrophy, stretch marks, development of bigger blood vessels. So they're not for chronic use really in any scenario. And for the average person who's had ink, I think just a couple applications is all you need. But that's a nice little pearl for once you've removed the occlusive dressing.
What do you see like as the future of tattoo aftercare?
A couple things. One, it would be nice to see inks that cause less inflammation and that heal faster. I mean, imagine getting an ink that only needed to be cared for a couple days or one day. You put the SecondSkin on at the inking session, you take it off the next day, and it's done. You don't have to do more elaborate, extensive care. So inks that are less inflammatory would be nice. Inks that are safer, where the ingredients are known, they're more stable and not prone to photo degradation, which is a huge problem that we're going to be hearing more and more a lot about over the coming years. That would be nice. Making inks that can be lasered off with byproducts that are perfectly safe and easy to do in a single session. But that's just for the inks. For the wound care afterwards, it would be nice if you could have a spray-on version or a paint-on version of your product. Because you have to cut it, and there's always a little bit of waste, and it does take time to get it on, even if you're good at doing it. To have something that you could brush on or spray on, and you're done would be really cool. I think that would increase compliance and popularity if it's really easy to get on and is flexible over joints too. That would be very nice. We've got good products now. The cleaning products are really good. I don't see a need for improvement in the colloidal silver soaps or chlorhexidine. Those are fine, and you can keep going. The emollients that we have now are really good. Coming up with new, safe, hypoallergenic antimicrobials is always reasonable for the aftercare. Be great to see some of those. What we have now is pretty good, though. I think the necessary advances are going to come more in the inks than anything else over the coming years.
You talked about inks causing the irritation. And in my mind, what causes the irritation is the needle. Can you describe the difference between those? Because that's not something I had considered, is that the ink is causing the irritation.
Yeah, certainly there's a mechanical component to this. These needles are going in and out of the skin, 100 times a second. So there's definitely trauma. So if you needle somebody with no ink at all, the area is going to bleed, it's going to get red, it's going to get puffy, it'll be tender, but it's not going to take a week to heal. It's not going to take 10 days. 2 days later, it's going to be fine. The ink itself contributes to the inflammatory response. Some degree of inflammation may be useful. It hasn't been studied. It's possible that the engulfment of ink particles by white blood cells in the skin called macrophages is one of the reasons tattoos are so durable, because you can find the ink particles within these, years later at the same spot where the artist initially deposited them. So you probably don't want to get rid of all of the inflammation. You just want to kind of finesse it so that it doesn't go overboard. But it's not just a mechanical inflammation. And that by the timing of the healing as it varies from one color to the next. As I mentioned with reds, in my case, they can take me 3 or 4 weeks to get fully healed. When everything else that was inked on the same day with the same needles is long healed. So the inks themselves, which can have a long list of ingredients, definitely contribute to the inflammatory reaction. It's not just the mechanical trauma.
You talked about the list of ingredients in ink, and we know that in the past there have been some problems with contaminants and that sort of thing. Do you want to cover any of that?
Yes, yeah. Historically, inks have had contamination with things like lead and mercury, cinnabar, agents which potentially could not only carcinogenic but also cause allergy. You know, the cinnabars and the old reds and yellows were notorious for causing lots of tattoo allergies. And by and large, they're not supposed to be in inks anymore because we've got other pigments that replace them that are safer, but they still can kind of weasel their way in from some products to the next. And at least in our country, there's no requirement for putting the list of ingredients on them like there is on a box of Fruit Loops. Even though they're both going into your body, there's no requirement to list what is or isn't in them. They're just proprietary formulations. And studies have shown that there are contaminants with heavy metals, other carcinogens called polycyclic aromatic amines and hydrocarbons, and even bacteria. Ink manufacturers who go the extra mile to study their ingredients, to have third-party companies certify that they're free of a lot of bad bacteria, the trouble and expense to do that, and we should reward them with our business.
And one of it's interesting, it's something that I had never considered before, but when you and I talked previously on the phone, and I've seen you do a presentation, you talk about the dangers of laser removal and the breakdown of
Yes.
the inks and how that affects your body. Will you go into that a little bit?
Sure. Lasers do quickly what the sun does gradually. So radiation will break bonds in the large organic molecules that are used for most of the colors, aside from black. The ink colors are largely made out of azo dyes, which are big, complicated organic molecules. And they are non-toxic, non-carcinogenic in and of themselves. But in many instances, they're not fully stable. They're prone to being broken down, particularly by ionizing radiation, by ultraviolet. So predictably, certain bonds get broken in these molecules by either the sun gradually or lasers very quickly that produce byproducts that are not always safe. Things like benzene, anisodine, cyanide are common breakdown products of various colored pigments used for a lot of tattoo inks. And it's not common knowledge. Most people know that you're supposed to keep your ink out of the sun because the sun will fade it, gradually doing what laser tattoo removal does. And, nobody wants that because you put all the time, effort, and money into getting nice ink. You want to keep it looking good. So most people know, yeah, you're kind of supposed to keep it out of the sun, but it's not common knowledge what that fading actually represents. And this breakdown produces meaningful quantities of carcinogens. And there are now epidemiologic studies that show what appears to be a quite significant increased risk in lymphoma, which is cancer of the lymph glands, where we know ink travels to in people who have, in particular, lasered off their ink. There's a slight increased risk, it seems, with just having tattoos, and that may be all from sun. That may be just from that gradual breakdown of pigment if you get it out in the sun. But then that risk seems to be magnified as much as 7-fold if you laser off ink. So I would never recommend at this point that anybody laser off a colored tattoo. Black and white is probably okay if they're made from titanium dioxide or carbon, but any colored ink, you shouldn't do it because the long-term safety seems pretty dubious.
Yeah, you talked about the breakdown and it producing carcinogenic materials in your body. Is that for just the inks that have these problems and the bad stuff in it, or this is for all?
No, these are for good pigment molecules too that are in pretty much all of the manufacturers' inks. There's nothing wrong with these ink molecules. They're not contaminants. They merit to being there. They're hypoallergenic and they're non-toxic, but they can be broken down, and that's the issue. And it applies to everybody. It applies to all of them. And it's not the fault of the manufacturers. The consumer, the collector, needs to baby their tattoos. They want them to look good and they want to stay healthy themselves, and then you need to baby them because these breakdown products are real and they're not in trivial quantities. A big tattoo can have 10 or 12 grams of ink in it if you're going to a good artist who really saturates the area. That's a lot of material. Think about the medications we take where you take like 1 milligram of some drug every day, and then you're talking about grams of ink in your skin. that could be broken down into quite meaningful quantities of carcinogens. It's been measured in laboratory studies where they take like a piece of pig skin that has a good amount of tattoo in it, and then they bombard it with a laser, and then they biopsy the skin and they measure the concentrations of these carcinogens. They're in meaningful quantities.
Yeah, it's surprising to hear because tattoo laser removal has always been touted as a good option for getting rid of ink that you don't want anymore.
Right. And there's an assumption that it's safe, right? Because you don't go to the back alley to go get your tattoo lasered off. You go to a respected, that looks nice. They're board certified. They've got this $200,000 machine. What could be safer than that? But it hadn't been studied enough until now. And so I do not recommend laser tattoo removal for any colored ink for anybody. Not until we have inks that can be broken down into other byproducts.
Is there anything that we didn't cover that you want to talk about or you think is important for clients, tattooers, medical professionals to know?
Let's see. We didn't talk about pain control much. It's an interesting topic because everybody perceives pain differently. And so you can't make recommendations that are one size fits all. Some people are kind of traditionalists and they say that the pain is a big part of getting the ink, and they look down on people who want some degree of pain control, that you're a wimp, or it's just not a meaningful experience anymore. And I get that. It's not a completely meritless argument. No pain, no gain. But at the same time, you don't have to be tortured or tap out. Some people will say, I'm done. It's like, we're only 4 hours into this 8-hour session. I'm done. No, and that's not good for anybody. That's not good for the artist who's booked those extra 4 hours. It's not good for you either, because the work isn't done. You don't want to flinch and move at the wrong moment. So, pain's okay if you deal fine with it, or if you like it, that's okay. But if it's going to be beneficial so that you can sit still for 8 hours or 10 hours, getting your collarbone or your knee inked, it's okay to be comfortable. That's not bad. You're not a loser or a wuss or any less of a collector if you're interested at all in pain control. And for that, depending on the region and the person, I'll recommend anything from Tylenol and ibuprofen, which I think anybody can do unless they've got a history of allergy or gastrointestinal bleeding, to nonsteroidals. And then there are other things that you can do. I think it's useful to promote prescription non-narcotic medications, because narcotics, are risky. You can get addicted to them. So I recommend gabapentin, a drug used for post-herpetic neuralgia often. It's slightly sedating. You want to test it out before you go driving after taking 4 of them, but it's not really addictive. It's not a restricted substance. It's quite safe and widely available, cheap. So I promote that a lot. And in some circumstances, for a really painful area, especially if you're in a multi-day session and you're really not looking forward to it and you want to take a little bit of something stronger, those can be prescribed in very limited quantities, things like Percocet or Tramadol. But those are sort of the last resort. But yeah, pain control is one thing I wanted to mention. It's not, I don't think you need to be ashamed about it. If it's something that's going to make the experience pleasant for you and not make you run out the door early or flinch at the wrong moment, then I think it's totally fine. You don't have to be a purist.
What about topical lidocaine?
It's an option. I think a lot of artists don't like it because I think it affects the glide a little bit. But it is an option. I've tried some of them. You want to be careful with the amount of body surface area that you cover them with. These are pretty strong, and lidocaine can be toxic to the heart. You can get arrhythmias. There have been cases of people slathering lidocaine topical all over both legs and saran wrapping them to get it in better, and then going to get laser hair removal and dropping dead before they get there from lidocaine toxicity. So in small surface areas, sure, like 4 or 5 square inches, sure, you're not going to kill anybody that way. But I would check with the artist first, because I've met a few who don't like them, who think that it doesn't glide right. It affects the art. So yeah, I would definitely check with an artist first to see if they're going to like that. Bactine is a spray you'll sometimes see used, which is antimicrobial and also has benzocaine as an anesthetic in it. I've seen several artists use that as well. And if they're using it and they don't mind, that's totally fine as well. So yes, there is a role for the topical anesthetics, but you want to clear it with your artists first.
Yeah, one of the things that I have heard from artists is that it does make the skin different to work with. So some really don't prefer it. And I think you're right. You should talk to I know people who go in and get tattooed and don't tell their artist that they're using a topical lidocaine or something like that. And it's definitely something you should talk to your artist about beforehand and see what their feelings are about it. Anecdotally, I know a tattoo artist who traveled to get tattooed, had his whole back done in one day, used lidocaine on the whole back. On his way home, went into shock, started vomiting, and just having a really difficult time, obviously. So yeah, I think pain is your body's way of saying, you need to stop, or at a certain level, like this is too much. This is going on too much, right?
But you don't want to stop in this case. So you want to
Right,
take
right.
the edge off a little. You don't want to stop
Sure.
unless, unless you absolutely have to. But yeah, you just have to treat these medications carefully. There's a risk benefit profile to anything, whether it's a topical or an oral or injectable medication. And so, the general rule you should be to do the least amount of pain control that you need. And I think if you go in with it and with that in mind, then you're going to stay out of trouble.
You did mention ibuprofen, but my understanding
Mhm.
was that it's a blood thinner, and so it's typically not something that you want to use before getting tattooed.
I don't think it matters that much. I never stop anticoagulation in patients who I'm doing surgeries on. Most of the time, unless there's some of the heavier duty prescribed agents, clopidogrel, I can't tell. In fact, there was a study done where they had dermatologic surgeons do surgeries on patients who were either on Coumadin, a famous blood thinner, or not. Half of them were, half of them weren't. The surgeons didn't know who was who, and they had to guess after the surgeries based on the degree of bleeding who was on Coumadin and who wasn't, and they didn't get it right. They got it right half the time because half the people were on it. So I don't think it's too big of an issue. There's going to be some bleeding anyway. And drugs like aspirin and ibuprofen, they do interfere with platelet function a bit, but they're not that heavy duty. Unless you have a history of a bleeding disorder, it's probably okay to take a little bit of it. I've regularly taken ibuprofen and acetaminophen on all inking sessions, and I haven't had any artists complain that, gosh, you're really, bleeding too much. This is making the work difficult.
Thanks for answering that. See a little bit of your ink peeking out there. You want to give us a little tease?
Oh, okay. So this is the work that I had done in New York and in France with Sandri Riffard and Yomiko Moreno. I started, here we go, with the anglerfish was the first piece that Yomiko did. And then I went over to Sandri and he worked on the skulls and the bottom of the sea. And we went back and forth. And what was fun about that was how it evolved, how the initial template, the initial plan evolved into something that I ended up liking a lot at the end because it went one step at a time and we made adjustments. That's another argument for sort of not doing it all at once unless you're totally set on the design, because maybe it can evolve a little bit over time as you see what it looks like when it's on your skin.
Hey, Dr. Kerner, this has been fantastic. I really appreciate you taking the time to come on, talk with me. And I hope we can do more of these in the future. Maybe do like some deep dives into some specific topics. I
Sure.
think that would be great. So if
Yeah,
anybody's out
that'll
there,
be
you want
fun.
to hear about something specific, leave a comment, let us know, and we'd be happy to talk about that. Thank you so much.
Yeah, yeah, sure. And if anybody wants my website, it is theinkdoc.net.